Hi everyone, I'm Dr. Akhila, consultant fertility specialist to the hospital Banjara Hills, Hyderabad. Today we're going to talk about the do's and don'ts of IVF. IVF in itself is quite a daunting process, and when it comes to the amount of medications we give, the time spent, and the sensitive instructions to follow, all this can be a little challenging in terms of reducing the stress and increasing the success rates. So, through this journey, what we need to do and what we should not, let's quickly discuss about that. So, first thing, let's come to the things that we need to do. Importantly, to understand the process of IVF, the success rate involved with it, we need to understand that we cannot make it 100%, and we need to also prepare uh, to understand the timelines that it may take, how long does it take for a stimulation to take place, when do we do the embryo transfer, whether a hysteroscopy or a laparoscopy is required or not, how many scans are involved, how many visits we need to make, the injections, how many days of injections do we need to take continuously. These are some of the things that we need to understand before we start the IVF journey. Once the understanding is good, we're able to follow all the instructions that the doctor gives much better during the IVF cycle. It is always, rather even before we start the IVF cycle, a healthy lifestyle is what is very important, which includes a healthy, balanced diet, inclusive of fruits, nuts, vegetables, seeds. All these should be included in your daily diet. Also, hydrate yourself. About 6 to 8 glasses of water is what we recommend. And importantly, sleeping for at least 8 hours, uninterrupted sleep is adequate. And exercise, moderate exercise is recommended. Weight loss before you start your IVF process is a must. That improves the egg quality, and the success of implantation also is better. During the IVF cycle, we don't recommend any strenuous exercise during the pickup cycle or the transfer cycle. Um, uh, Exercise in moderation, a little bit of walking is definitely something that we look forward to. Other than these lifestyle habits, what is very important is to follow the prescription, the medicines that are given. You need to strictly adhere to the prescription and follow all the instructions given to you. We supplement multivitamins as well. All these multivitamins need to be taken as prescribed. The hormone tablets, the hormone injections, anyway, some of them are timed. So you need to stick to the time and take these very religiously. The multivitamins also need to be taken as prescribed. Um, Having understood all this, we need to know what risks the IVF process can have. So we need to understand what is ovarian hyperstimulation, giving so many hormones and drugs. There could be fluid accumulation in the body, which we must avoid. Necessary precautions and medications will be given to you. All those should be taken. These are some of the do's of an IVF cycle and a transfer cycle as well. Now let's understand what we must not do. So typically, no alcohol, no smoking, avoid junk food, avoid uncooked meat, avoid processed food. These are some of the things that we definitely need to avoid. And strenuous exercise, again, we need to avoid. Stress should be reduced as much as possible. Once we understand the process, once we understand uh, how IVF works, automatically a little bit of the stress does reduce. But we need to put in a lot of effort into trying to reduce the stress by yoga and meditation and things like that. And we must also avoid hot water baths, hot tubs. It helps in better implantation of the embryo. And Basically, when it comes to the do's and the don'ts, things need to be done, whatever you do should be done safely and in moderation. That is extremely important. Complete bed rest is an absolute no. At the same time, rigorous exercise again is an absolute no. So you can continue your daily routine, and a little bit of walking also is absolutely allowed. When it comes to intercourse, during the pickup cycle, that is when the eggs are being picked up, we normally tell the patient to avoid intercourse because the ovaries are very big, the hormone levels are very high, and the chances of OHSs can be higher. And during the transfer cycle, also we tell the patients to better to avoid intercourse. As such, it is definitely not a no, but it is always better to avoid intercourse and follow the instructions accordingly. Um, when it comes to climbing stairs, if you are feeling comfortable, you can climb one flight of stairs. That is not an issue. But multiple times is something that we need to avoid. Can somebody do their daily house routine? If again in moderation, it is definitely allowed. Complete bed rest again is not allowed. About half an hour of work she can do. So these are some of the things about what we must do, what we should do in moderation, and what we should definitely avoid during your IVF cycle. Any questions, please? We're thinking effective plantations and okay. Now, when it comes to stress, there is no research or study which says that taking stress definitely gives you a negative outcome. But when you're try to de-stress yourself, make yourself happy, the outcomes are definitely better. So the ways to do it is try to calm yourself, try to do some yoga, meditation, try to avoid getting into the arguments. Talk to your clinicians about whatever is the issue. Your partner may have doubts. You talk to your doctor and clear the doubts together. That gives you a better perspective. Completely avoiding exercise is not something that we must do, even though you're fit. A little bit of exercise helps you in a long run, not just for fertility, but even for your general health. So, a bit of walking, yoga, meditation, mild exercise, avoid strenuous exercise, all this definitely helps in better chances of pregnancy. So sleeping position in pregnancy, you can suit yourself, and whatever position is comfortable for you, you can take that position. Left lateral position is what we normally think and recommend is better because the blood supply is slightly better. But should you be comfortable in on the right side or supine position, you can totally take whichever position. What foods to totally avoid, like I've already mentioned: junk food, processed food, oily, spicy food, uncooked meat, alcohol, smoking. These are some of the things that you definitely should and must avoid. Household chores, I've already mentioned, in moderation can be done. Cooking, about 15-20 minutes of standing in cooking can be allowed. About half an hour of household work can be allowed. Make your movements gentle. Don't stress yourself because of the household work, and these can be done. No bed rest is recommended. At the same time, no strenuous household activities. It is quite normal to be stressful, to get scared after a failed pregnancy. Now, when you're pregnant, try to calm yourself. Talk to your doctor about all your fears and why did you have a failed cycle is something that you need to understand and try to take necessary precautions so it doesn't repeat in this cycle. A little bit of yoga, meditation always helps. Traveling in IVF cycle can be allowed. There are no complications. You need to make sure that you're taking your medicines very religiously during your transfer. Uh, this you must keep in mind. And if there are no other complications of a pregnancy, you can choose to travel as well. A little bit of cramping, light bleeding after embryo transfer is natural, it can happen. Should the cramping be very painful or persistent? Should the bleeding be more than spotting and prolonged? That is when you need to talk to your clinician, get a few blood tests done, get a scan done. Otherwise, a little bit is expected, nothing to worry. Though you must report to your clinician that you're having these kind of symptoms, but it can happen naturally, there's nothing to worry. Pregnancy can continue even with these kind of symptoms. Sudden movements or lifting light weights per se does not cause any harm. Uh, like I've already mentioned, it should be in moderation. Uh, Light weights can be lifted, no bed rest, at the same time, no strenuous activities. Thank you.